Hello and welcome to the Rioho Wellness Podcast. This is Margit Jefferson and I am here with Andrei Gospodarczyk, the founder of Rioho. The vision behind Rioho Wellness is to create a tipping point in wellness worldwide, and this podcast will contribute towards that. In each episode, we explore different health issues that present as case studies in Andrei's practice. They range from everyday common health problems through to extremely serious health issues and illnesses. We explore body parts and how they respond to nutrition and environment, and we work on inspiring people to change their life for good through an everyday wellness focus. Rioho is a wellness modality that is unique because it focuses on healing and wellness through basic food and exercises that maneuver the body back to a state of balanced health. People literally jump out of their skin with energy and vitality when they follow Rioho. And it's an incredible turnaround for many who have had low energy for years through to people who have had complex health issues that don't seem to budge. The podcast is an interview format and ranges from 20 to 60 minutes. And if you'd like more of an introduction on Andrei, please see the 3-minute introduction in the first podcast on the homepage. And at the end, I'll be here to give you a little bit more information. So without further ado, let's get into this episode. Today we are exploring diabetes and blood sugar level disorders, mostly amongst adults, but we do also touch on these issues in children. And we've asked a series of questions and explored a lot of topics that we hope makes it highly relevant to people suffering from this sort of thing, and also provide some really valuable tips and guidelines as to what you could do to improve your wellness. We hope you enjoy it. The first question I have is, when clients come in and say to you they have diabetes, what do you immediately think?
I think, okay, we need to look at the person's diet. We know from traditional medical systems, we know from the understanding that Rioho has, and we know from modern research that lifestyle is 99% of the cause of diabetes and also the cure. We know that certain stresses in life can cause these problems, meaning pregnancy, fatigue, combinations, but the dietary issues are the main thing here to look at. So we try and improve lifestyle a little bit and be careful doing it in a way that allows the person to gradually modify their lifestyle choices, meaning exercise and nutritional intake, so that they can stabilize their digestive functions.
When you say dietary, so what sort of questions do you ask them and what do you check for?
Okay, so the questions we ask are things like, what's your favorite sort of food? What do you have for breakfast? What do you have for lunch? Because it gets very complicated when you start to eliminate specific foods. It's better to get a good general overview of that person's lifestyle by asking them what they have for breakfast, lunch, and dinner, rather than saying, do you have a lot of sugar, or do you eat a lot of dairy products, or do you have soft drinks? Because the perspective we have of ourselves is not as clear as we would think. It's quite interesting. You say to someone that, do you have sugar? And they say, no, I don't eat sugar. And then you'll find that if you go through what they have for breakfast, for example, they're having some cereal that has an enormous amount of added sugar to it. They're having yogurt, which has more sugar in it than soft drinks. And there's just a lack of perception on the person's part as to what they're really eating and what's in their choices about food. So it's good to know exactly what they're having for breakfast, lunch, dinner. I ask them that. It's nice to know if there's been any big changes in their lifestyle, and also knowing that if we have a lot of stress in our lives and put on weight suddenly, it can affect metabolism also. In our way of thinking, there's one organ system that regulates the whole digestive function, and that organ system controls everything from taste buds to elimination. It's an overall view. It's not broken down into very specific details about how everything works exactly. It's an overview so that we can manage lifestyle. It's very hard for a person to deal with their pancreas, but it's very easy for someone to start to chew their food and not eat too much. So simple ideas like chewing your food, what foods you eat, how much you eat, these are the ideas that are behind the Ryoho viewpoint of the digestive function. What your stools looks like, how much you eliminate. These are things that are important so that the person who comes to us can have some personal responsibility about their digestive function rather than getting lost in specific hormonal details, things that they can't deal with without understanding modern Western medical anatomy and science. So, but they can deal with knowing that certain foods are good for you in terms of digestion, and some foods are going to hinder your ability to digest foods properly. So looking at a system, looking at how we can provide information to that person based on what we find has been part of their lifestyle choices. If we find that their choices for breakfast, for example, is a lot of sweet food, something like yogurt full of sugar, lots of fruit, and a sugar-laden processed cereal, where they're thinking they're doing the right thing, but of course it's going to throw their whole body out of balance, having an extremely sweet food for breakfast. We can then say, swap that to savory and make balance. The body heals by making balance. So they're the sort of things we look at, the understanding of how the body works in a very simple way, which makes it accessible for the person to be able to make choices. You can't make choices if it's based on something you need to deal with through chemicals or technology, meaning manufacturing pills or potions or things that involve medical systems that the person can't take responsibility for. And everyone knows now, thank God for World Health Organization, they're letting everyone know very clearly that over 90% of all health problems are lifestyle choices. They're manageable, and making that accessible to someone is going to be part of the solution when it comes to problems like diabetes, especially. Losing just 10% of your body weight has proven to make a huge impact on problems like blood sugar disorders, where diabetes comes from.
You talked about the body being a functioning system. I want to ask you a little bit more about this to understand from a Ryoho perspective, what is happening physically to a person with diabetes? What is failing them from a system point of view when they have diabetes?
Well, the lovely thing about Ryoho is that it allows us to get a grip on our problems. You can get lost in detail, and knowing how the body works allows you to deal with very complex issues in a simple way. So, for example, the arms are very complex. We've got lots of bones, muscles, tendons, how they attach, how they work. There's everything from cartilage to bone to tendons. There's nerve endings. There's all sorts of things in there that can get very, very complicated. But the arm does a particular thing. It has a function. And all of those myriad structural parts and all those different aspects of the arm on a physical level are actually there to perform a function, and it bends in a particular way and it rotates in a particular way. And that's its job. Now, if it's doing its job properly, we don't have to worry about any of the physical aspects of it. It's the same with the digestive system. If food is being absorbed and being used if the digestive system is eliminating properly, which it does both of course, then it's going to be doing the thing it needs to do. It's going to be performing its function. And that's what we want. Then there's no need to concern ourselves about it and use it in a way that enhances our lives and allows us to get on with our lives. So we concern ourselves about if it's not working properly, then we start to try and figure out some sort of reason for it not working. It's the same with the digestive system. And with the Ryoho way of understanding, what we try to do is to get that functioning going again. Now, if structural changes happen because of functional changes, this is a worldview that is quite different to a lot of the ways of looking at how we operate as human beings that is being used these days. There's a more complex way of seeing the body, and there's a more simple way. And the simple way is allowing us to take some action and understanding that the digestive system has a functional root, the same way that the arms have a functional root. So if we use the arm in a functional way and bend it and do push-ups and nurture it with rest and good food, then the structure changes. So if we do 10 push-ups a day, in a few days the arm will change, and then we can do 20 push-ups a day, and then the structure of the arm will change. And it's the same with the digestive system. If we challenge the digestive system and rest it and work it as a system, as a function, then it can structurally change. One of these things might be something like giving it different food. Another thing might be something like reducing food. Another thing might be fasting. Another thing might be involving the digestive system in some process of very specific foods, like only eating fruit for a little while or only eating grains for a little while. So it's a very different worldview of how the body operates, where you're having a bigger picture of how the body functions through understanding that function leads to structure, that how we behave, what we do, turns into what we are. Every little thing we do every day leads to our physical manifestation. So that's a very different way of thinking about things, I think.
Yeah, it sure is. Leading on from that, what do you think of the use of Western medicine to control diabetes?
Western medical systems, which is based on injury treatment, it's based on looking at what's broken or trying to narrow it down, of course, like a broken bone or a torn tendon or some sort of cut. It's fantastic. I mean, it's almost magical the way that modern science can now repair physical damage. It started, of course, 100 years ago with trying to fix soldiers, and it really developed in those war years into a comprehensive, very intelligent system once we got a grip on antibiotics and analgesics, which allowed really to get into the body and repair physical damage. But it doesn't address the responsibility that we have in terms of functioning, how we behave every day. There's disparate aspects within Western medical science where one side of it is looking at nutrition, but the other side isn't. These things need to come together. And it's an important thing to have in the future so that people can take responsibility more based on deep understanding of how we actually function in terms of what we do to ourselves and the results of that. If we use things like chemicals to repair our functioning, we're going to be looking at injuries. Now, what I'm saying here is that problems like diabetes, problems like blood sugar disorders, if we address only the symptom, which is our inability to metabolize sugar and inability to digest properly, in other words, then we're not going to really be looking at the cause of that. What's led to this problem? And it's the same as any kind of injury. What's created this injury? And how do we deal with that? Why have we got a problem? Why have we got coughing? Why have we got fever? Why have we got a headache? These are important things. Even breaking an arm or a leg, we need to know why that's happened. How has that come about? What's happening in the person's life that we have such a major injury where you break something? We don't think in Riojo that breaking an arm or a leg is a little thing, even though it happens a lot. We don't think that a headache is a little thing, even though it's considered almost normal now to have headaches and it's not a big deal. You just take a pill. We want to know why we've gotten to this point where we do have an injury. And something like blood sugar disorder is looking at the whole digestive system and trying to understand why that has come about. Suppressing the symptom by taking some kind of drug and relieving the problem is not good enough. It's going to allow the problem to slowly get worse. And then we end up with much bigger issues. And quite often there is going to be even problems rising from the therapy itself, meaning that taking things like insulin or something similar can have side effects that are different to the problem, but sometimes worse than the problem itself. It's hard to make statements about these things because everyone is different, and we're talking about different age groups, we're talking about different lifestyles, we're talking about different causes, and there's different types of diabetes, of course. But a large percentage of these problems can be solved with just a little change in lifestyle, not a big dramatic shift, just a little change in lifestyle. And some pleasant feeling comes where you're feeling a little bit better. There's some responsibility needs to be taken on the part of the person who's got the problem, not just to go and buy a product that solves your problem. This can lead to much bigger problems. It's like running out of money and then borrowing some money. This creates debt. We have a problem with our digestive system, and we go and borrow something. We go and get a medical treatment that then adds to the problem in a way. It solves it in some ways, but it creates more problems in another way. Yes, the modern treatments that we have available to us are magical, profound, and extremely effective. But the end result of not dealing with the cause and not trying to see one's personal responsibility in the process is very damaging in the end. We all need to question what we're doing and how we're doing it. There's a lot of information out there coming from many different ways of thinking, but there's two main categories, and one of them is based on injury treatment, where you're using differential diagnosis, like things based on anatomy and physiology. And then there's a whole other way of looking at the body based on functioning. And the functioning way of looking at things, of knowing that the body has certain functions that then leads to structural components and the healthy functioning of those structural components of the body. So, for example, the stomach, the pancreas, the spleen, the small intestine, the thyroid function, so saliva, all of these things we see as one unit of digestive function, and taking responsibility for the correct functioning of that is really very important in terms of digestive health. Not putting things in there that cause damage, taking away the things that are inappropriate for good digestive health. Now, once we run into a problem, we have to then maybe assess those things and try to figure out what's going on. Our first signs are fatigue and some sort of ill at ease, and then we should start to look for answers in those areas. One problem for us all is knowing where to go for help. We might go to a naturopath, we might go to a chiropractor, we might go to an osteopath or an acupuncturist, and all of these people will have different explanations based on their metaphor, their way of looking at how the body operates and what the causes of these problems are. Those different metaphors allow the therapist to explain to the person what is going on for them. And that's an important first step. And so it's important for us to be able to take some responsibility. But when it comes to Western medical science, it's very hard for us to take some responsibility for our health from there. Although some information is starting to filter through now, which is really good, where some nutritional guidance, some ideas about general health and what is good for a person who has discovered that they have some blood sugar disorder. It's starting to filter through, which is really good. But tailoring it to that specific person for their specific problem is the only way to be very effective. And we have to treat the individual with their particular problem. That's what's necessary. So, yeah, Western medicine is absolutely wonderful. I'm in awe of it, and I think it's extremely useful. But when it comes to general health, there is an aspect of personal responsibility, and the only way a person can take that personal responsibility is if they have understanding of how their body works in terms of functioning and what they can do on a daily basis. That's what's important.
Yeah, I think you just highlighted an amazing point, which I would like to underline because it's something that we've spent hours talking about offline. And that's that an internal condition like diabetes is a major and serious internal injury. And what I'm wanting to underline is that it's really a complete reframe so that people can really start to understand that there's much to be done to heal that and not just putting a Band-Aid on it. Like we were talking about in our 2019 startup podcast, illness can be a signpost to our wellness. And I think that anything internally, such as diabetes, and there's loads of other conditions, people don't see that as a major injury. They just see that as a condition. They don't frame it like a broken arm, as you were saying. So they don't look at it from the perspective of fixing the broken arm and letting the bone heal so that they can use it fully functioning again. And I think that's a really interesting concept that you've just raised.
Western medical science sees people being injured, and it's based on injury treatment. And what we see is not so much the injury, and we don't consider the injury as the beginning and end of the therapy. What we see is not the injury in isolation. We don't see the broken arm. We don't see the blood sugar problem as standing alone. We see that there has been a cause and that there is some personal responsibility, whether it's a broken leg, a broken arm, or diabetes, that there is some personal responsibility involved in ending up in that position, and that even if we can't see that personal responsibility as a beginning point, we can see that there's personal responsibility in the healing process. If I can then present a slightly different idea where people can relate a little bit better, and still using diabetes and blood sugar disorders as the foundation. For example, having, like I've mentioned before in other podcasts, having a heart problem where we might then end up in the terrible position of having to have a surgery of some sort, which is a very dramatic thing. I mean, we're very good at it now, and it saves people's lives, of course. But unless we change lifestyle, unless we start eating better, exercising a little bit, then that same person, if they keep drinking lots of alcohol and having lots of meat and lots of sugar and cigarettes, then they're going to be back in the hospital very soon for another heart operation. But if they change their lifestyle, that heart operation is going to be a gift of a second chance, and they won't end up in the hospital again with a second operation. So it was lifestyle that needed to change, not having the operation. The operation was treating the injury. And most of the time, it's not the heart that is the problem. It's every other organ that is sick that has led to the heart just straining so hard that we end up with these, as we say, injury. So there's a personal responsibility before the injury and after the injury, that just taking some medicine for the diabetic symptom is not the solution. The same way that we need to understand that just borrowing money to solve our financial issues, and now we've got more money, is not going to solve the problem. It's going to create, in fact, more problems in the end. And so we can see this as a world issue now, where the world is just borrowing more and more money, and we're not really looking at the cause of this. We're just borrowing more and more money. So the world's ending up in more and more debt. And it's just a reflection of us as individuals. One of my wonderful teachers, Arata Sensei, said we pay a lot more than money for the things we take. It's a worldview that allows us to live in harmony with nature. Once we realize that we're a part of a very big system, and the responsibility we have for our health and ourselves is to set up the circumstances of healing, and that something else heals us. In other words, that there's microorganisms within us that do the job of healing. We set up the circumstances for that healing. Like having a cut, we put a Band-Aid on it. That's not going to fix the cut. The Band-Aid doesn't fix the cut. Something else comes along and stitches the skin back together and repairs it beautifully, leaving just a little mark. And it's the same with the diabetic problem. We need to set up the circumstances for that healing. The injury can be treated with chemicals. The injury can be treated even with, in some cases, surgery. where we cut parts of the digestive system out. But it's not taking the responsibility for our position, our relationship within the universe. Within nature is a system and a process that allows everything to stay balanced. And we have a responsibility to find out what's happened to us and make balance again. So balance is the key, finding out what's wrong and making balance. If we look inside ourselves, we can have hints of that, but knowledge is important. Human beings have used their minds to separate from nature, and we also need to then use our minds to get back in tune with nature when we find a problem. It's a worldview that allows us to take some responsibility and have a little bit of humility and understand that we need to surrender to nature for things to properly heal. We can do, and even broken bones, we can stitch them back together, put in metal screws, but it's still nature that comes along and heals it properly. We can only set up the circumstances for that.
I want to talk to you a little bit now about the compelling reason to do something about it. A lot of people who are taking diabetic medication to control blood sugar issues seem to be quite happy that the medication is controlling it and managing it. And particularly if the symptoms can be held at bay and they know they're enjoying their life and they can pop a pill or do whatever they need to do. There's a bit of a quantum leap here. What is the compelling reason for people who fall into this category? So we're not talking about acute patients that you see in your practice where it's a life and death situation. It hasn't reached that point yet. Is it that the long-term use of the Western medicine can cause major irreversible internal injury? And how can we frame it so that people listening to this who may have diabetes or blood sugar issues or who might know someone suddenly sit up and say, okay, this is the reason that I really need to start focusing on my lifestyle choices?
In the Ryoho understanding, things are not just physical. In fact, the physical is a result of what's important. And what's important is our feeling and our internal relationship and the relationship that comes from having that relationship with ourselves and those things around us, our environment. So the body is a tool for those things. It's not the beginning and the end. It's just a means. And it's also a reflection of what's going on. So it's a much bigger picture. Survival is paramount, and that'll always dominate. If you've got a physical problem, we need to deal with that first. But the reason that we've ended up with a physical problem is what's important. Something's been going on for usually a long time because all of our bodies are incredibly strong and resilient and adaptable. So it takes a long time to develop problems. I mean, yes, there's all sorts of issues out there, the chemicals and in utero problems and all the rest of it. But generally speaking, it takes years for problems to develop. The relationship we have with our body is what we're talking about within Ryoho. And that relationship then eventually ends up being prosperous or ending up with problems. And we need to drop our arrogance and deal with those issues. Now, the reason that you want to do that is because of the bigger picture. And we see the bigger picture in each of us as the more subtle things of our feeling. Now, we can isolate different aspects of ourselves within different aspects of our physical body. Now, what this means is that the digestive system is our ability to absorb and eliminate. Now, it's not just absorbing simple things like proteins and complex carbohydrates and minerals. It's a much bigger thing than that. Every single person that we deal with within Ryoho that has a blood sugar problem has also a problem with absorbing on a more subtle level. All I have to do is explain to them that they're not receiving. And it might sound all very new age, but just that simple comment to anyone who's got a blood sugar problem, digestive problem, in that vein, they will immediately relate to that. They don't feel like they're getting anything. They have a lot of love around them. They have a lot of energy around them. They have a great job, but they feel dissatisfied. Now, before I lose everyone, let me just reframe that, which means that the ability to take in food and chew it, eat it, and get it inside yourself leads to some kind of level of satisfaction. So if you eat the food that you want, you're absorbing it the way you want to absorb it, you get it, and then you feel satisfied. If it's not working properly, then you can eat food till you're full to the throat and still not feel satisfied. And then you have to stick some chemicals in there to get any kind of satisfaction. And even that isn't enough sometimes. The chemicals could be ice cream on top of the meal that you've just eaten, even though you're way full. So lack of satisfaction is a sign of digestive problems. When your digestive system is working properly, having just a little bit of noodles, a little bit of brown rice, a little bit of grains and beans, and you feel satisfied, you actually really do. In fact, the healing process with the digestive system means that you eat a lot less food and feel satisfied with that. The opposite is eating an enormous amount of food and having all sorts of strong chemicals in there, from chili to sugar and icing sugar and Coca-Cola and etc., and requiring that every couple of hours. One of the signs of blood sugar disorder is getting irritable and cranky and uncomfortable because the blood sugars have dropped and feeling faint. So big repercussions. So what I'm talking about is the fact that dissatisfaction is a sign on the physical level of digestive problems. So you're feeling dissatisfied because your digestive system isn't working, and so you're looking for something else in the fridge. On the more subtle level, we have dissatisfaction on our relationships. We have dissatisfaction on the level of our work. We have dissatisfaction on the level of our life even. And so there's compelling reasons for people who've got blood sugar problems to try and solve that digestive problem so that they have the organ function that supports satisfaction on all levels. Otherwise, you'll feel all the time that there's just not enough for you. But when it's healed, when it's okay, just a simple smile from a stranger is enough to make you feel happy, light, fulfilled. A wave from a child across the road, a lovely sunny day is enough to make you feel like your life is full. That little support from the universe, the same way that a simple handful of soup in the morning is enough breakfast and gives you lots of energy and support and you feel satisfied. And so the same thing happens when you have a good digestive system on the more subtle level, that having the presence of your partner or your loved ones, or if you're living alone, your work or what you have around you physically, your clothing, the amount of money you've got is enough, that you're satisfied with that. Sure, we always want more and we're grateful for more, but we're satisfied with what we have. And that's a wonderful feeling, and it's a normal, natural, healthy feeling. And that's what we should look forward to. And it's something to work towards. Just having a physical problem, fixing that up is okay, but we're not separate from our bodies. And we are not our bodies, of course. We all know that. But on the other hand, we are very attached. And when the body is threatened, when it's in survival mode, when it becomes sick, then we become sick also as an entity, as a person. We fall into that hole of pain and misery and discomfort that the body is going through. We need a healthy body so that we can get on with our lives. So I hope that's a compelling reason to fix our digestive system. Then, of course, the spine has a completely different effect on people. The blood has a completely different effect on people, how it influences us. But the digestive system is all about satisfaction, feeling fulfilled, and being happy with the things that we have around us, as we should be. And it's normal, and we deserve to have that. We deserve to work towards that. And having just a pill or some sort of chemical that solves our problem for us on a physical level can in fact rob us of the journey that leads to satisfaction.
There's a couple of things in there that I want to pick up on, and one of them is the digestive system, but we'll get to that in a moment. What symptoms do you see presenting in people who have blood sugar issues? So I'm after some of the more subtle symptoms that people may not necessarily relate back to their condition.
the more subtle ones that they should pay attention to before it becomes serious. And this is important. This is what we need to have. We used to have relatives around us on a daily basis. And, for example, having grandmother around or grandfather around and saying, sit down, there's something wrong. And you saying, no, there's nothing wrong. And them saying, no, you have to sit down, talk to me with what's bothering you. With our nuclear family now and the busyness of our lives, there's no one to actually really check on us and who knows us from when we were 2. And even now that we're 40 or 50 or 60, that parents or our grandparents can see that there's subtle signs. So we don't have that around us so much anymore. That's a rarity. And we've lost that gift of having a village atmosphere around us. Like in China, traditionally, the medical practitioner, the local doctor, would check on everyone on a regular basis because they would be paid every week if everyone was well. As soon as someone got unwell, they would stop being paid. And so there was a great level of concern for everyone's health. And so they would check on things like how everyone is feeling. They would check on how everyone is eliminating. They'd ask how people are getting on in the family if someone's being irritable lately. And so the signs for digestive health, as the subtle ones, are the ones that are important, that we can then deal with them without leading to major issues. And the more subtle signs are things like fatigue, but we don't even know that we're feeling tired because our digestive system isn't working properly, because we have drinks now that eliminate fatigue, the high caffeine drinks, or even just coffee or green tea, or just eating more sugar. And so we don't recognize the fatigue. Fatigue is one of the very first signs where you're running out of petrol because your digestive system isn't working properly. Another sign is mood changes. Simple little things like feeling irritable for no reason and then being happy when you get a certain food. One of the signs of digestive function is that mood changes when you eat. In other words, when your blood sugars start to become unstable and you're becoming hypoglycemic, that if you eat some sugar, you feel better. And you shouldn't have felt bad in the first place, maybe feeling like you were hungry, but not feeling faint and irritable. And you shouldn't have the problem of great discomfort by just skipping a meal, missing a meal. That's not normal. Maybe you feel like you'd like to eat, but certainly not feeling fatigue and irritability. So getting irritable is another sign where the defense systems have kicked in. So your body has tensed up because you can't have food. And as it gets worse, it's like every hour or every 2 hours. Another sign that people should look for on a more subtle level is you're eating breakfast and thinking of lunch. That's where you're obsessed with the digestive system. And the digestive system is just one little thing that is part of our lives. But when it's broken, we're obsessed with it. And so we get over-concerned with food. And it's not a healthy thing. People can turn it into a lifestyle almost and become foodies, what we call foodies, and totally concerned about food all the time. And it's not a healthy lifestyle. There's a lot more to life than just food. Food is something we're very grateful for, and it's something we enjoy enormously. Like breathing shouldn't be a big part of your life, but it's something that we're very grateful for and we focus on and we use as a tool for self-development. And we practice breathing as part of meditation, as part of Ryoho exercises, but we're not obsessed with it and we're not concerned about it all the time. And so these are the more subtle signs. Of course, these things evolve more and more and become more and more of a problem. Developing a little bit of a midriff, bloating in the belly, some love handles, even though we accept those as normal things, we can see now that it's not just a middle-aged thing. We can see now that teenagers have got this. So it's not a sign of middle age, it's a sign of poor health. What used to be a sign of middle age now is common in 20-year-olds and teenagers, where the belly is a little bit bigger than it should be, and we've got love handles, we've got hips that aren't right. And this is what I've seen over the years, where what used to be old age problems of heart disease now is a middle age thing. and even people in their 20s. There's even a specialist hospital for children with cardiac problems now, and this was not a common thing when I was young. It certainly wasn't something that was obvious. So these are the little subtle signs where fatigue and things like irritability and food obsession, these are the first signs that one should be concerned about when it comes to these sorts of problems. And maybe we don't accept those as simple little signs to pay attention to because we have a society that supports these things. We want to get people to take as much as we can now. Our society is based on these issues. And modern China now is a good reflection of this, where diabetes is growing at a massive rate there. Consumerism, in other words. Now, we don't want to all get rid of consumerism, of course, but we want to know that there is good food to eat and there's bad food to eat. Eating everything is not okay, that everything isn't terrific.
People who have blood sugar issues or diabetes or know someone in their family who does and are doing a mental checklist. Yes, this person has fatigue. Yes, I can see there's mood changes. Yeah, they seem to be obsessed with food. And we're talking very broadly here because of the nature of the podcast. But is there anything else that you could add to the list? Is there any cognitive functioning issues?
Absolutely.
Yeah.
Now, some people listening might think, look, that's everyone I know. And yes, you might not know anyone that is eating whole foods, has complex carbohydrates as a normal part of their diet. You might not know anyone that uses sea salt in their cooking that actually activates the food. In other words, sea salt in the cooking breaks the cellulose binding in food and makes sugar available to us. If you're not using sea salt, you don't know anyone who's using sea salt and grains, then you might not know anyone who doesn't have these problems. It's not a common thing anymore. And that's why our society is the way it is and why our society is in debt. And so you might think it's normal, and we kind of accept moodiness, irritability, obsessiveness about the self as normal. It's not. It might be average, but it's certainly not normal. But that's the world we live in now. And so, yes, you might not know anyone who's not moody. But yeah, more subtle cognitive things are the blood sugar is very important for brain function, of course. Most blood sugar gets used in the brain. One of the very first signs of blood sugar disorder is yawning a lot and fogginess in the head, where it's not happening in the brain as well as it should. You try and concentrate and study and get sleepy. That's one of the best signs, one of the early signs where you're trying to study. It's easy to watch TV. It's easy to read something that is compelling, like a thriller, but actually trying to read something or study something that you need to go over in terms of work or some kind of exam that you're going to have or something that is very interesting that requires the brain to work. It's not just feeding it with stress. Then you'll find that you get sleepy or drowsy or you have to read the paragraph over and over again. That's a sure sign, and that's what we call a foggy mind. And that's a definite sign. Cognitive function is dropping based on the fact that you're just getting a lack of sugar to the brain. Yawning is part of it. Drowsiness is part of it. Sleepiness is part of it. Foggy mind is part of it. Nothing to do with memory. Memory is a completely different issue. But yeah, fogginess in the head.
We've looked at some of the peripheral symptoms that people may not necessarily direct relate, which I think is fantastic. And hopefully people are saying, oh yeah, well, I do have a blood sugar level issue and these are things that I can see in my physiology that's going on for me. So moving on then to some specific foods that contribute to diabetes other than natural and processed sugar, what are they?
What they've discovered is fructose and excessive amounts of fruit. Now, even though fruit is a good, healthy food, we still need to understand that balance is important within the whole foods themselves too, that the body needs to have some kind of balance there, that we can adapt to fruit, but once you start having a lot of fruit juice, that it stops being able to process it properly and we develop fatty layers over the liver and then we have all sorts of digestive problems coming from that. So what I'm saying is that fructose can be a very big issue and people don't realize that just having vegetables and having no balance within the diet in terms of their vegetarian type of thinking. Just because you're vegetarian doesn't mean that you're leading a healthy lifestyle. So I do come across a lot of vegetarians that are having honey, maple syrup, carob bars, rice malt, lots of oily food, and no salt in their cooking. There's a lot of sodium in meat, and so meat eaters get away with it a little bit more. But vegetarians who don't understand that balance in diet is important, they end up with all sorts of blood sugar problems. And it's very common now, I'm seeing. They think that being vegetarian excuses them from any kind of ideas of balance, and they end up eating far too much sweet, that a little bit of salt is important in the diet. So there's another category that comes about, even though they think honey is okay, but it's just pure glucose. It's the same as white sugar almost, honey. And it's a wonderful substance. It's great, and it's used as a medicine, but it is extremely strong. And things like fruit juices and smoothies that people are having a lot of, and very sweet food like dairy can create lots of problems. Dairy is a big part of digestive problems now. Lots of milk, lots of yogurt, lots of cream. These things can create problems for people also, whether you're vegetarian or not. But the vegetarian category, I'm seeing a lot of people who are vegetarian and I'm not saying they shouldn't be vegetarian, that they should be. It's the way to live. It makes a much healthier body. A little bit of animal product is important in certain climates. A lot of animal product in other climates where you've got no other food sources except meat in some climates. But you have to be very, very physical, and the climate has to be extremely cold for you to be able to use a lot of animal products. So generally the vegetarian option is much better in normal climate. So yeah, there's the vegetarian problem, and they all running into lots and lots of blood sugar problems and lots of issues there. So where we think things are healthy for us, like honey, maple syrup, fruit, lots of oily foods, and things like white flour, these can cause massive problems with the digestive system and are all considered in the same vein as raw sugar. And then there's, of course, the other kinds of sugar substitutes. People are having chewing gum with sugar in them. There's things like stevia and sorbitol, and even though one is known to cause cancer and the other one is considered healthy, they're all sweet. And the body doesn't distinguish that much between the flavors. It's just as happy with stevia as it is with white sugar, because it just sees sweet as sweet and reacts to sweet in the same way. It doesn't discriminate too much between the different kinds of sweet. It just sees sweet as sweet. So we can run into problems this way. We need balance in the diet, whether you're vegetarian or whether you're a meat eater, and that balance has to be based on knowing who you are, what you do. So a person who's very active is going to be different to a person who's sedentary. And whether you're older, post-menopause, or whether you're young and a bit of a geek and sitting in front of the computer for 10 hours a day, all of these factors need to be taken into account. And it's not intellectual. It's based on who you are and based on knowing that certain foods work for you and certain foods don't, and go on your feeling. It's asking a lot for people to take responsibility, but that's what we need to do and explore those things. So as a general response to that question is people need to take responsibility, and a whole lot of sweet is in there because it's so nice. And nice is great, but too much nice leads to problems. There's a lovely statement from my yoga teacher, Masahiro Oki, where he said, good is good, but too much good can become bad. So if something's nice, it's great, that's nice, but too much nice can become bad. And it all changes depending on the balance within you of what suits. So it's good to go to sleep, yes, when you're tired, but too much sleep can become bad. It's good to be awake and do things, but too much awake and doing things can become bad. And the nice thing of sweet is really nice, because when we digest food, if you chew it well enough, and if you cook something, everything becomes sweet when you cook something long enough, because the end result of digestion is sweet. It's satisfying. And so having a lot of sweet is very, very satisfying, but it can end up creating a lot of problems. A little bit is great, and we have to learn to regulate ourselves and look after ourselves.
Do dairy products contribute to diabetes and blood sugar issues? And I'm talking about cheese and natural yogurt that has no artificial or natural sweeteners in it, milk, those sorts of products. I'm not talking about the sweetened yogurts or the sweetened milks or anything, or ice cream, but natural dairy products.
There's a lot of people who are lactose intolerant, of course, but even they can have a little bit. And dairy is a great food in certain climates, and it's a great food for certain people, and we have to know whether that suits us or not. And as a general rule, if it doesn't make you sick, it's a good food. It's that simple. And natural dairy products, natural yogurt, natural cheese, again, is a good condiment, but some of us react badly to it. And we need to know what suits us, what doesn't. But they're certainly not going to contribute to massive digestive problems if there's a little bit of dairy in your diet, if it's used as a condiment and not used as a food source. So a condiment is something that adds flavor to your food. Things like brown rice and whole wheat noodles and organic vegetables and good quality beans prepared properly and seaweeds and salads, all of these things are good foods, but they're fairly neutral in their taste. So what we do is we use sea salt and oil, and we use things like spices and herbs, and we use things like miso and shoyu and tamari and a little bit of dairy and a little bit of meat even. For some people, I mean, I can't, but I know that suits some people. And then those little extra things, the condiments that transform the food into wonderful meals, that's what's important to make life entertaining and individual. So a little bit of dairy is not going to cause problems, but if you're going to have some healthy breakfast cereal, which is organic popcorn or something, or Wheaties with no sugar, and then pour a handful of yogurt over the top of that, and then at lunchtime have wholemeal sourdough bread, and then a slab of cheese on top of that, and then avocado on top of that, you're going to have problems because 50% of your diet is saturated fat, and it's going to make very big problems for us. So having that viewpoint of using dairy as a condiment, where there's a teaspoon of yogurt on your cereal, so you're not eating food to overwhelm you. You're eating food to support you. And it's a different way of looking at modern life, but it's also a healthy way of looking at modern life where the world is very entertaining, not just food.
Diabetics and people with blood sugar issues are constantly measuring their carb intake. So they're always reading on the back of the label what the carb intake is and trying to keep it under a certain level. What do you think of that?
Carbohydrates is the cause and the cure. It's part of the main reason that people end up with blood sugar problems, and because they've had far too much refined carbohydrate, but also just overeating in general and lack of activity. Because when you're active, when you actually do something, when you get a little bit of a walk or a little bit of a run, some exercise, what happens is that your body generates sugar. It starts to metabolize sugar, and being active is one of the cures for blood sugar problems, and being inactive is one of the causes. So blood sugar is all involved in this process. So carbohydrate is a way of getting sugar into our system, and there's a healthy way of getting it in, and there's an unhealthy way of getting it in, of course. Refined sugar is very, very nice, but it causes very big problems. Anything that's really nice, if you have too much of, is going to create very big problems. So there's a lot of dialogue now about carbohydrates, where we should avoid all of them altogether, including whole grain. And it works. We isolate our intake to foods that are maybe meat-based or just vegetables or something like this. This kind of fasting creates a result, and a healthy result or an unhealthy result. But in the end, we do need some stable blood sugar functioning, and fasting of some kind is always a good thing. One of the great results we're having now with diabetic problems is eating normal healthy food, and it's good healthy food, not junk food, for 5 days. and then not eating for 2 days. This was something advocated by my yoga teacher in the 60s and 70s. And it creates good healing. It's the same with taking all the carbohydrates out of your diet for a while. You can get some result this way, but it's a big strain on the body. All depends on your condition. It all depends on who you are and which way is best for you to go in terms of healing yourself. But carbohydrate is the issue. It's the cause of the problem, having too much carbohydrate in a refined manner. And this can come from many, many sources, as we discussed earlier. There's no difference between brown sugar and white sugar. It's a myth. There's no difference between honey and white sugar in terms of how the body reacts to it, really. There is some benefit with honey in using it as a medicine. There's a few minerals in honey that allow it to work as a very good topical medicine where you can use it on sores. It's fantastic, and it's good to use in a drink for certain conditions, but you can't use it regularly as a regular food source. It can create problems. It's like anything else. We have to look at ourselves and decide what suits us and what doesn't. If you're running into blood sugar problems, then carbohydrates are the answer to the problem by avoiding them or by introducing good quality carbohydrates into your diet, complex carbohydrates that break down slowly. And it's like, again, having any kind of physical injury where you exercise the body slowly back into normal functioning and chewing your food very well, cooking your food with salt so that it makes good quality complex carbohydrates available to you, these sorts of things. And there's lots of information out there now about these issues, but what's not out there is an understanding that we're very subtle beings, and what's really important is our feeling of, in this case, satisfaction and the ability to absorb information, love, feelings, ideas, intuition. All of these things are part of our digestive function, and they're important. These things are what actually allows us to have a fulfilled life. Oh, well, what happens with people who've got problems with their spine, for example, where the discs are fused, where they're born with spinal disorders, where they're born with maybe some limbs missing. It's congenital illnesses. I mean, we need to have healthy pregnancies, and that's one aspect. But we also need to have some understanding of how it can make balance for people with all sorts of problems, whether it's missing a leg or whether you have digestive problems. And it's not good enough to say that it's just bad luck. We can mitigate problems. A deep understanding of being human is that we all have weak aspects of ourselves and we all have strengths. We all have talents. And we all have weaknesses, and they can be extreme weaknesses and they can be extreme talents. We use our talents in society to help other people and make ourselves useful, but we have to work on our weaknesses always and try to improve them. So you can be born with some kind of blood sugar disorder, and the healthy thing to do would be to work on it in some way, and it mitigates the need for intervention. So you might need some support, but not as much as you would if you didn't take any responsibility. Extreme cases require extreme support, but it's surprising how much the journey of self-healing contributes to the nature of the person. We have to take responsibility for our condition, whether we're born with it or whether we develop it later on in life. It's still our problem. Easy for me to say, I know, but it still ends up that way, and we have a difficulty. And whether it's blood sugar disorder or whether it's some kind of spinal problem or nervous disorder or whatever we're born into this world with, and we need to still be grateful for our existence and do the best we can with. That's the end result of that. But yeah, it may be not always to have the full healing, but that journey of healing is what we're all going through on a constant level, on more subtle levels, on more physical levels, and it continues right up until you die. It's always looking to make balance and improve yourself. And we're all working at different levels with different things, some more obvious than others. That's why we're here, is to improve ourselves and take this life as a journey of training and self-improvement and self-development. That's the only way to look at any of these tasks that we've been given, and our bodies are given to us as a gift. And sometimes it's not in perfect working order, but we make the best that we can out of it.
What are your comments about children and diabetes and blood sugar level disorders?
The lovely thing about children is that they're just walking stomachs and they're absorbing everything all the time. If you give them good food, and it might be a struggle, but if you give them good food, they bounce back. There's no investment in their illness. They do want to feel good. By the time we're adults, we've manipulated our environment to match our problems. And so it's much harder for us to adjust ourselves back to a natural state of health where we're actually just functioning okay again. Children don't have that investment in their illness, and they bounce back really well. Some good quality herbs, a good source of nutrition. And yes, there's a struggle because children like us, once you've got a blood sugar problem, you need more and more sugar because you're not metabolizing it properly. You have sweet cravings all the time. So fixing that up is a struggle. But if you're clever, you can give them good food and call it cake, but it has no cake in it. It's a matter of labeling. Making cookies with just wholemeal flour and a bit of oil and understanding what the children need. But it's too much. Children are getting far too much junk food, and so it's a really common problem. We're trying to address it, but we're not getting very far in modern society. And so now we have a massive problem with children. They don't deserve it. They don't even have the opportunity of being half okay, unfortunately, because we've poisoned them so much. It's a real shame.
Out of everything that we've spoken about, one theme keeps coming up again and again through this podcast, and that is that the inability to process sugar manifesting in diabetes or blood sugar illnesses is a direct result of a poor functioning digestive system.
Sure. The digestive system is damaged and then it can't process, and the damage that is caused to it is by giving it chemicals that it can't handle. We've damaged it. We've caused big problems. When you eat things like white sugar, your digestive system literally goes into shock. It spasms. And that's why in the old days, people would forbid you to have sweet before dinner so that you wouldn't lose your appetite. Appetite is damaged by sugar because the end result of digestion is sugar. And so if you have a sugar hit, like white sugar and sweets or lollies or fruit juice or something similar, honey, something like this, it goes straight into the bloodstream. It doesn't even hit the stomach because the blood recognizes it as refined sugar, and it sucks through the lining of the mouth. It sucks through the lining of the stomach and goes straight into the bloodstream. And the whole digestive system spasms looking for the food. It thinks you've just eaten a whole lot of food and becomes very, very agitated. So we lose our appetite. People who have some kind of digestive issue, whether it's anorexia or bulimia, they also have blood sugar problem happening. You can't not eat food for days unless you binge on sugar. There's a psychological problem, yes, but there's also a chemical problem involved. So you have these carbohydrate problems coming from abusing the digestive system. The digestive system's end product is trying to digest food into sugar. And if we give it straight sugar, it loses its functioning. It has no purpose anymore, and it gets quite hysterical. There's a common knowledge that if you have no purpose, then you just fade away. People who retire and don't have any hobbies or direction in life, they very quickly fade away. It's the same with the digestive system. You've got to give it its job. We've got to use our legs, walk with them. We've got to use our arms. It's good to do some little exercise every morning, whether it's a walk or something similar, where you make the body do what it's supposed to do to keep it functioning. These are important ideas, and these are the problems that the digestive system runs into when you give it very damaging food. And whether it's white sugar or brown sugar or any other kind of refined type product, even white flour, it can lead into massive digestive dysfunction and the end result being some form of diabetic dysfunction. And it can come from different sources, whether it's a liver function or pancreatic function or feeding into each other, starting with a liver problem, leading into a spleen or pancreatic problem or the other way around. So it all depends on the individual. It's not linear, it's cyclic. And so things start as a little thing and develop into a very big thing, and we can adapt to it. But in the end, all the resources in the world can't keep us going, where we've got all the medicines and the machines all helping us, but we still break down in the end. It just creates more debt.
To sum up, 3 very short Ryoho protocols or concepts that a person with diabetes or blood sugar issues can start to think about.
3 very simple ideas that might not be the full solution, but will be part of the solution. They have to be. Otherwise, it's not dealing with the problem at all. And these very simple ideas are going to be not everything maybe, but certainly going to be part of everything, or they might be everything. So the first one is salt in the cooking. Salt is a cooking technique. If we pickle things, they transform into a more digestive food. If we cook something, makes it more digestible, makes it easier for your digestive system. If someone is sick and unwell, we don't give them raw carrots, we give them some soup. So salt in the cooking is really important, not on your food. We want to use salt in the cooking so it transforms the food to make it more digestible. And in that way of more digestible, meaning that makes the sugar available to you, allows the food to break down in the right way. So a little bit of sea salt, not too strong, just go on your taste. But using sea salt in the cooking, 3 rules for salt is the beginning of grains and halfway through the cooking of vegetables. If you're steaming them, of course, that's different. But as soon as the smell starts to change when you're frying things or even when you're boiling things and it starts to smell a little bit cooked, add the salt. Good quality sea salt. And use salt at the end of beans because they're too hard. Wait until they're soft, then add your salt. And there's different forms of salt you can use, but always based on good quality sea salt. So it purifies the body and alkalizes the food for you a little bit and breaks it down, makes it digestible. It's the same thing as using fire. It just breaks the food down. And we use that to make food available to us as human beings, the same way as we use clothing now and shelter. We use salt and fire because that's what human beings have become now. We need those things. So the next thing is to use a lot of grains, which is complex carbohydrate. If we're going to use grains to help with this problem, it has to be well over 50% of your diet. Introduce it slowly, and you can monitor your blood sugar levels and watch it make a very, very big impact. And the third thing is exercise. And by now you might have guessed that these sorts of blood sugar problems are very emotional. It makes a very big impact on your feelings. Like I was saying earlier, your sense of satisfaction, but it creates all sorts of problems where it's irritability, whether it's anger, sadness, hysteria, happiness, grief. All of these feelings are affected emotionally and on a more subtle level of just satisfaction. Makes a huge impact, which is why sugar is so attractive, because it's so emotionally satisfying. And when you start doing exercise and changing your diet a little bit, it makes a very big impact on you emotionally. We shouldn't let our emotions override and affect us completely, but it's very difficult when you're trying to change these sorts of deep problems. It's good to do a little bit of exercise, not too much. And when you start to feel emotional, just take a break, breathe deeply, walk a little bit, and then do a little bit more exercise, and don't stop at that point. So salt in your cooking, lots of grains, slowly introduced, and exercise. Part of that exercise can be chewing your food properly. None of this works very well without, of course, chewing. So I'll leave you with those 3 suggestions.
And that wraps it up for today. And we hope you've enjoyed this episode just as much as we've enjoyed putting it together for you. Any listeners who would like to learn more about Andre's work or Ryoho can connect and follow on Instagram and LinkedIn using the address of Ryoho Wellness. We spell Ryoho Ryoho and then add wellness on the end, obviously. Episode notes will be loaded up and available at ryohowellness.com, which is the master website. And just a few more things before you take off. Number 1, do you have a health issue or question you would like explored in one of our podcasts? Please submit it to us at the website where there is a contact page, ryohowellness.com website. Number 2, would you enjoy being notified by very short email every time we do something on Ryoho Wellness? This includes notification of our up-and-coming wellness podcasts and other things towards our tipping point. If you want to receive that, go to riohowellness.com and drop in your email address and you'll get the very next one. And we hope you really enjoy it. Thanks everyone for listening, and thank you, Andre, for another fantastic episode. See you next time.